Namaste बिटिया, हमेशा खुश रहो बिटिया. A very good morning to you all. Myself, JV'n Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine at Faculty of Homeopathic Science in JAYOTI VIDYAPEETH-FHS University, Jain. In today's lecture, we are going to discuss about the history taking in case of nervous system disorder. So, how to take the history in case of nervous system diseases? We are going to start today in the clinical class. In the history, the emphasis should be laid on number one, time relationship of the symptoms. So whenever a patient of nervous disease is coming to you, while taking the history, you should pay an emphasis on number one, time relationship of the symptom, that is the onset of symptom, since when the disease the patient is suffering from, the progression or regression, how the disease progressed or how the disease regressed, the frequency of attacks or the frequency of disease condition or the acute attacks that the patient is having, the duration for which the acute attack is being faced by the patient, like epilepsy. For an example, epilepsy. So how does the epilepsy started? How does it progress or regressed? What is the frequency? The frequency of attacks in a particular day or in a week or in a month, and the duration for which the epileptic attacks a patient is having. All these things have to be kept in your mind. So time relationship of the symptoms is very important. Onset, the progression or the regression, the frequency and the duration. Next one is the localization. Localization means which part of the body is affected the most. That is the involvement, whether the involvement is symmetrical or asymmetrical. Which part is affected and whether one side of the body is affected or both sides of the bodies are affected, symmetrical or asymmetrical. The third is the social and the personal history of the patient is needed to be asked. You should remember that this is the continuation of the previous lectures of the history taking. So this is not the first lecture of history taking, but the continuation of the previous lectures. So you should also listen to that previous lecture in order to get the complete picture of history taking in case of nervous system disorder. The social and the personal history. In the social and the personal history, you need to ask about the occupation of the patient. The patient's occupation may be relevant in causation or triggering the neurological disorder. Because if a patient is remaining in the state of stress for a long time, that can precipitate many types of conditions. So, the patient occupation is relevant for knowing the causation and triggering factor of various kind of neurological disorders. The exposure to toxic chemicals, like if a person like that patient is exposed to different kind of chemicals, that it can affect the patient directly or indirectly. The recurrent overuse of certain joint predisposing to entrapment and neuropathy. Next is the diet. The patient, whether he is a vegetarian or a non-vegetarian, that is neurocysticercosis, alcohol intake and quantity of the diet is very important. Past history. The past history for diabetes, hypertension, renal diseases or dialytic therapy. Alcoholism, smoking, tuberculosis may be asked for. The past history of diabetes, hypertension, renal diseases or dialytic therapy. Alcoholism, smoking, tuberculosis must be asked for. You should ask for the past history of the diseases since childhood, the diseases that a particular patient has been suffered from. Then you have to check for the drug history, the history of the drugs that a particular patient is taking, the medicines that a patient has been taking, because it can affect the neurological system directly or indirectly. Ask about the drug being taken by the patient has been taken in the past, such as antitubercular drugs, anti-epileptic drugs, anticoagulants, antipsychotics, oral contraceptives, nitrofurantoin, and vincristine, etc. Then you have to ask about the family history of the patient. Many neurological disorders have a genetic component. Some may be strictly genetic. So you have to always inquire about the family history of the patient, whether any member in his or her family are suffering from any kind of neurological disorders. Because there are many diseases that are genetic, which runs in the families. Example, hereditary ataxias, muscular dystrophies, myotonias, Huntington's chorea, and hereditary neuropathies. So you also have to inquire about the family history of the patient. Then you have to check for the social and personal history. This I've already discussed, like occupation, diet. Then you also have to check about the marital status of the patient, whether he is married or divorcee. Bereavement and change in occupation are important precipitating factors. You also need to inquire about the sexual contact of the patient, history of contact with unknown partners to be asked to explore any possibility of sexually transmitted disease. So this was all about the history taking of the neurological system. In the next lecture, we are going to continue with this history taking. I will again repeat all the points just to get a recap. We have to emphasize on the time relationship, onset, progression, regression, frequency and duration of the complaint, localization, which part is affected, unilateral or bilaterally symmetrical or asymmetrical, occupation, diet, marital status, or sexual history has to be asked for. You have to check for the past history, any kind of disease since childhood, history of alcoholism, smoking, tuberculosis, drug history, the different drugs that he has been taking since long, like anti-tubercular drugs, anti-epileptic, anticoagulant, antipsychotic, contraceptive, nitrofurantoin, and vincristine. You have to check for the family history for the presence of any kind of genetic disorder, which a patient can be predisposed to, like hereditary ataxias, muscular dystrophies, myotonias, Huntington's chorea, and hereditary neuropathies. So these are the various things that you need to inquire in a patient with a neurological disorder. So this was all for today. In the next lecture, we are going to continue with this particular lecture. So this session was powered by digital version 2.0, JAYOTI VIDYAPEETH-FHS University. I hope you are satisfied with my digital session. If you have any query, please mention in the comment box and I'll try to resolve it. So this was all for today. Thank you very much. We will be meeting in the next lecture tomorrow. Thank you.